manifestation as well as a driver of the systemic oppression and exclusion of women and girls. We know that all women and girls are at risk of violence, but women and girls who face multiple and intersecting discriminations are at greater risk. During COVID-19, we know that the various forms of violence against women and girls have been heightened, and feminist and women's rights organizations have really been central in stepping up to the plate to intervene in different ways. And so we are here today to listen firsthand to the experiences of organizations and individuals who are addressing the multiple and intersecting discriminations that put girls and women at greater risk when it comes to violence in its varied forms. So that is just by way of context in terms of our event. And I will now, before turning it over to the superb panelists that we have, I will ask my colleague, Louise, to play a video that has been prepared for this purpose by Femnet, who is one of the co-sponsors. Thank you very much. Louise, over to you.
We ushered in the year 2020 with great expectations and plans to commemorate the 25th anniversary of the visionary Beijing Declaration and Platform for Action, a blueprint plan with strategic actions to achieve equality, development, and peace for all women without exception.
2020 is a year where we're going to come together across the globe as women in Africa and put together our political declaration and really spotlight the achievements that women have made through this groundbreaking declaration, but also put a spotlight on some of the challenges that women still face and the need to accelerate implementation of the recommendations that were put forward and the statutes that are within the Beijing Declaration.
2020 was indeed the moment to take stock of what has been achieved and reflect on what has been the drawbacks in advancing gender equality and women's rights. At the same time, the Generation Equality Forums, convened by the UN Women and co-chaired by the governments of France and Mexico in partnership with the civil society, was viewed as a platform for scaling up urgent actions, coordinating, financing, and mobilizing accountability for gender equality. But then, the COVID-19 pandemic happened. The pandemic has ravaged every sector, left the most vulnerable even more vulnerable, and deepened pre-existing inequalities, injustices, and discrimination that now threatens the Generation Equality goal of accelerating progress for gender equality by 2030.
My name is Edita Diambo, and I'm a founder of Feminist for Peace, Rights and Justice Center. I work with women. My vision is to empower women, like political development, economical development, and social development. And when I talk about social development, I focus mainly on the voice, because most of the time, the perpetrators uses our voice to take advantage of women. And in Kebera, I ensure that I make women to learn how to say no. And when they mean no, everyone respects that no. I grew up in a very patriarchal community where it was a very retrogressive experience for women and girls where I come from. When I was 6 years old, I was raped. And when I come every day in this community, I see the house that I was raped in. It makes me to be more aggressive every day. And again, when I was 16 years old, I was gang raped, and one of the gang raper was my neighbor, was a neighbor, and one was a relative. And it was a very hard experience for me, because later I realized I was pregnant, and then I had to access unsafe abortion just for me to survive as a young girl. So I didn't enjoy my teenage so much, and there was a lot of discrimination at that point, because the people who gang raped me came back in the community and started humiliating me, and it was a disappointment. I'm trying to solve all violence against women, but specifically, I will never want to see any girl or a woman experiencing sexual violence. COVID-19 really affected me, just seeing how it has really hit the world, and also the effect that it has brought in women, especially women who have been living in poverty. It has been so difficult for women, and for real, it really affected me psychologically. Because every day when you work in the community as a young person, everyone has high expectation. When they see you, they see hope. And hope comes with a lot of expectation. Like yesterday, we didn't eat, and they need food, and they feel like you're the only one who can rescue them. So it was a very hard experience for me and other women. And also it brought fatigue in my body, because since COVID started, we've never relented. We've never sat down and relaxed. You talk about sustainable development goals. You talk about gender equality. And I've been sharing with my women in Kibera, gender equality is very expensive. So if you're speaking about Beijing and still women in Kibera are living under extreme poverty, then what are we waiting for? If women are still violated today, if women in business, economic space are still violated, where is our hope as women? If all these declarations are never implemented, and yet we want independent women, we want educated women, we want an enabling world for women. So what else do we need? Women are really tired of waiting, and women want all these policies, declarations, and bills to be implemented right away.
Thank you very much, Louise, for playing that. And I will now hand over to Mwanahamisi Singano, who is the program manager at Feminist, to first introduce herself, provide us a bit of context in terms of the video before I ask my questions. So over to you, Mwanahamisi.
Thank you very much, Kavinya. My name is Mwanahamisi Singano. I'm also known as Mishi Singano. I work with Feminist as head of program, and I was also a lead on Feminist COVID response. The context of the video, so Feminist did earlier on when the COVID started, we did monitor what is happening in the outside world. So we put our hands on the deck to monitor trends, what is happening, but also importantly, what was not happening. And also we had a lot of conversation with women themselves, and we are intentional to listen to the women who are in the periphery of power. And because of that, we found that the voices, stories, and realities of women are not captured. And that's why we did commission a documentary, and I invite all of sisters and brothers in this meeting to have a look at the documentary. It really brings together the intersectionality and interviewed and documented the lives across the spectrum and share their life experience and how COVID impacted them. So that was the context of which that video was documented, and we are sharing it today.
Fantastic. So thank you very much, Mishi, for that. So we know that Feminist adopts an intersectional and African feminist approach to all its interventions. And, just based on the video we've watched and some of the reflections that you shared as you were giving us background, please reflect on Feminist's work during COVID-19 in addressing violence against women and girls in their diversity. And in particular, if you could please highlight how the Pan-African Online Hub contributed to this, and any, recommendations that you might have, particularly now that, we are full swing in terms of the generation equality conversation, given that the draft actions are out and the Mexico and Paris forums are fast approaching. So over to you, Mishi, to give us your interventions along those lines.
Thank you, and thank you for the very long and packed question. So as I said, Feminist operates, and we identify ourselves as a feminist organization, and we have embodied African feminist principles, and African Charter of Feminist Principles, sort of like our go-to reference document. And we commit to journey to live the ideals of African feminism. And because of that, our work has been intentional in inclusion. Our work has been intentional in bringing intersectionality to become part and parcel of how we do work, who do we work with, and how we share our power, and how we are mindful and acknowledging that the privilege that we have, and how we open space. As I said, we did recognize as a feminist organization that the world before COVID was not equal. The world before COVID was unequal, was unjust. There are a majority of women living in poverty. The groups like sex worker, small-scale farmers, informal worker are at the periphery of power, and because of that, they have been carrying the brunt of injustices that are happening in the world. When COVID happened earlier on last year, as I said, we are intentional in monitoring the trends. We were interested to see what governments are doing and how they're doing it. Are there any plans for to reach out and support us? It was important to have a response plan which addressed the needs of everyone. And after doing that monitoring, then we realized two things. One, we realized that the government response plan are doing the business as usual, and some of these groups are not included. And because of that, then we had to start a campaign, a series of campaign actually. So we started with the inclusive lockdown, and that campaign was at the heart of it is to ensure everyone, if lockdown is a strategy to flatten the curve, then everyone needs to be supported to stay home and to provide all the support that they need. So that campaign was really successful in terms of highlighting the issues of specific groups and opening that space for sisters to share their stories and struggle. After that campaign, then we moved to the second phase of the campaign, and we called for dignified response, because we noticed the inclusive lockdown has yielded some result, and the government now are starting to respond and addressing specific needs, for example, violence against women. But that response is not dignified. So we called for dignified response system. We have talked, for example, with the sisters within the lockdown on the curfew, and they will tell you that the option, for example, when you are violated at night, or you are harassed or beaten by your husband, the option is to stay home to continue to be beaten, or get out to be beaten by the police, who doesn't understand that there might be needs for women to get out of their houses past curfew hours. And out of that dignified response campaign, which we have run quite some time to center the dignity aspect of the response specifically to everyone and to all women in their diversity, then we get to the just recovery, and that's where we are now. And in essence, what we are pushing is to ensure that we don't go back to the world pre-COVID. We use the opportunity of the COVID to shape a new world order, and to ensure that everyone has the right to live a dignified life. The other aspect that we realize, which is related now to our intervention on the hub, was the misinformation, the one-sided story of the pandemic. And in most of the countries, it has been the government just giving instruction and giving their response plan, for example, what needs to be done. And there have not been a feedback loop from the communities, from women, and especially from the marginalized group and the group who are at the periphery of power, to share what the reality is to them. So the online hub was a response to one, capture stories as they occur. Violence against women was one of the issue that in the beginning, most of the government completely put a blind eye on it, and they assume that homes are safe, and we know that homes are not safe. Vulnerable women have been experienced violence, and to us, those stories really helped to change the tone of the response. And second, we provide information about the service nearby, because we do know at that point, women also need to know where to call. For example, if you experience violence, who to call, what kind of, who is responding, what kind of support is available to you. But also we did provide the response plans. So for example, for the local organization that our member who are responding to the pandemic, to be able to have easy access to the plans that their government are putting forward in the spirit of analyzing them, but also critiquing them and engaging their government. So that's the work that we have done in the response. So moving forward in our engagement in the generation equality, we do believe, as the documentary has shown, 25 years of Beijing, progress has been made, but also the challenges are huge, and COVID-19 have in so many ways taken us back. For example, if you're speaking now about teenage pregnancy, FGM, the level of teenage pregnancy has gone high. So the gains that we have accumulated over 25 years, we have lost some of them. So generation equality is an invitation for us to be bold, for the government and stakeholders to be bold and to triple the efforts to address sexual-based violence. But also importantly, COVID-19 has shown us that what has always been called a private sphere is not a private sphere. And there is a role that government and stakeholders to play to ensure that women are not violated and women are not abused in their home. So we are calling for an investment, a commitment to address to address gender-based violence everywhere. Women deserve to be safe in their home, in their offices, in their marketplace, in their street. Women, like any other, have a right to be home. And to women who are listening, I think one of my biggest recommendations is to break the silence. What we have done specifically, and as you've seen in that video, we were intentional on voicing out, because silence always supports the perpetrators and doesn't support the oppressed. So we really recommend that we speak out and we break the silence and we share our story, because in that sharing of the story, there is the power of us coming together, and there is the power to demystify that violence is normal. If we are not speaking, we are endorsing the fact that violence is normal, violence is acceptable in our community. It's about time that all of us together become vocal and ending violence, and we need to use all the platform that we have to share that voice and to demand accountability. Thank you.
Thank you so much, Mishi, for those powerful sentiments that you have just shared with us around feminist leadership that is conscious of our power in the ways that we engage individually and collectively, things around a justified, a dignified response really to COVID-19, and by extension, addressing the question of violence against women and girls, which will really lead us to a just recovery. And thank you also for those very powerful recommendations that you gave at the end, particularly as we continue with our conversations around generation. So without further ado, what I'll do is to invite the next panelist, who is Jane Kihungi from Women Challenge to Challenge. Jane, you're welcome. Please introduce yourself before I continue with the questions that I have for you.
Hi, everyone. Can you hear me, Kavinya?
We can hear you, Jane.
Okay, thank you.
Please proceed.
My name is Jane Kihungi. I work for Women Challenge to Challenge as the head of the team, and I'm happy to be here today. Thank you.
Thank you so much, Jane, for introducing yourself. Jane, I have a couple of questions for you. Could you please tell us what the situation was like for women living with disabilities during COVID-19, particularly as it relates to violence against women and girls, and how you were able as WCC to intervene? And then maybe you could also end with some recommendations based on the experience that you have shared for us. So over to you, Jane.
Thank you again, Kavinya. In Kenya, situation has not been different from any other given country, given that the COVID-19 pandemic came when everybody was not prepared. And so when it happened, many people were caught unaware. And so the lives of many people in Kenya were affected, including women with disabilities. And this has seen the negative impact on the efforts that have been made in achieving social inclusion of women with disabilities, hence widening their inequality in the society. And therefore, it became easy to be violated. And you know, the violence against women with disabilities manifests itself in different ways. There's discrimination, there's isolation, there's stigmatization, and there's also denial of opportunities. And therefore, we saw women with disabilities in Kenya lacking their usual support that they get either from the family members, from relatives, from caregivers, from health workers. They could not go to the hospital anymore, those who needed like physiotherapy. They were more isolated because of lockdown. And that also, when people were told to stay at home, work at home, some people lost their job. And so they had to depend a lot on others for survival. And who was there to give them food? Nobody. To give them medical supplies? Nobody. And, you know, COVID itself has its own layer of discrimination and isolation, because the way it is infected, once infected, it's through touching, through close contact with people. And so nobody wants to come closer to you, even to take you to the hospital, especially those who need really high support. If you are blind, if you have physical disability and you are on wheelchair, you need somebody to wheel you around. And you're also fearing, you don't want to infect people, you don't want to get infected. So many people, that's how their lives were affected. And therefore, in conjunction with the law Cheshire, Kenya, we were able to conduct a survey to understand the situation of women with disabilities in Kenya. And we learned that many lost their jobs, salaries were reduced, and many were not even assured of their job again, that they would go back to their jobs. And you know, when you are depending on others, it's easy to be abused, to be violated because of that situation. Essential services were no more there, were no more available. And so we, as WCC, we had to have a toll-free number that women with disabilities could reach to us in case of they needed information, they needed any service, they could reach us, and then we could guide them. And we have seen that helping us and helping with women with disabilities, not only in Nairobi where we are situated, but all over the country. Women would get to us. They would call us and say, we have no food, we have no mask, we have no sanitizer. That had become gold in Kenya. And you know, if you really need to support yourself on any item around you, then sanitization became very important. So what did we do? With our partners, we were able to buy these items: sanitizer, face mask, food supply, and we gave to them, because some were saying they had 3 days without food and nobody was coming to their rescue. Again, we have a group of women with disabilities in Kenya that we are working with, and these are refugee women living in Nairobi. You are a refugee first, and then a woman with a disability, and a woman in the society, and you can see that intersection of this discrimination around you. And therefore, these women were also hungry. They have no source of income, even before, leave alone now with COVID. So we also intervened, and we were able to give them food, direct them to services. We also used the information that we collected during the survey to lobby the government for inclusion. And we could see the government giving a lot of information on the TV and the correct information when it comes to COVID. But again, we lacked, many people could not access, especially those who are deaf. They could not hear what the Minister of Health was saying. So what did we do with others? We were able to lobby for sign language interpretation, to lobby for information to be available in any format that women with disabilities could understand. We took to upon ourselves to share the correct information about COVID, just to be able to demystify some of these fears and myths around COVID. And to that point, what is my recommendation as an organization of women with disabilities at national and at global level, is that we need disability inclusive COVID response mechanism to be put in place. That we don't want to see people being left out, because if you leave us out in the response mechanism, then the government will not be doing anything, because we'll continue getting infected and infecting others. Another recommendation is that women with disability need targeted support around their income. Many have lost their jobs, so they need to be assured of that. We need the government to increase the social security support. And in this case, in Kenya, we have cash transfer. And we would like to see many women with disabilities being able to access that service. We are saying that we would also want to see a situation where women with disabilities are being meaningfully involved in decision-making and implementation processes of COVID and even after COVID. Response mechanism should have high-quality disaggregated data. This is a major problem in Kenya when it comes to collection of data. It is not disaggregated by disability. It's only done by age, by gender. And so to give that appropriate service to a woman with a disability, then the service provider needs to know before who is getting into the room. If it is a blind woman getting into the clinic, how am I going to give support to this woman without much touching them, without them knocking on the items? So really we need to be involved to give, so that we can give ideas on what needs to be done. Thank you, Kavinya.
Thank you so much, Jane, for those powerful insights, and really highlighting, this broader understanding of violence, that it just does not encompass, the physical forms of violence that people go through, but there are also other institutional forms, such as, the economic state of things that also exacerbates the situation, but also that we should really have a disability inclusive COVID-19 response that also looks at the question of violence against women and girls broadly, but specifically also to women and girls who are living with disabilities. So thank you very much, Jane, for those very powerful remarks that you made for us. Now, without any further ado, I will call upon the next panelists to introduce themselves before I also ask them questions. So Sarita, you're welcome. The floor is yours. Please introduce yourself, and then I'll ask you the questions that I have for you. Sarita, over to you.
Yes, thank you so much. Hi, everyone. I'm Sarita Kesi, Executive Director of Meeting in Nepal, and I'm so happy to be here and to share my experience with you.
Thank you so much, Thank you very much, Sarita. So could you please share a little bit about the experience of LBT individuals in Nepal during COVID-19 and how you are able to respond to that, and maybe some lessons and some recommendations based on that experience? Over to you, Sarita.
Thank you so much, Kavinya. I guess COVID-19 crisis has clearly exposed the severity of inequality of LGBTQ community. This can clearly be seen in how little access LGBTQ people have not been able to access relief packages and program input in the place by the government. In Nepal, like in many other countries, LGBTQ people rely on job in the informal sector with no security, living from day-to-day wages, which provide no access to insurance either. Especially during the COVID-19 crisis, the community members have been going through financial scarcities, which have led them to be unable to afford food, rent, and other essentials. The individuals are suffering in a greater sense as they have mostly been disowned by their family and have no other forms of social support or safety net. They are fully unemployed because of the lockdown, and they cannot seek help from families as they are not accepted for their identity, orientation, and sex characteristics. While government was planning to bring migrant workers from different Gulf countries, many LGBTQ migrant workers want to return, but due to pre-existing loan which they owe their employer, a human rights situation for another conversation, it was difficult for them to come back since government of Nepal do not have any specific plans for bringing back LGBTQ migrant workers. But they are left in even more vulnerabilities, being in a country where they cannot access healthcare, living in poor condition, and not having access to proper labor protection. The people still face challenges such as lack of essentials, medicines necessary for their health, such as hormone therapy, ART for HIV patients, mental health treatment, SIHR, lack of information or counseling on free healthcare services because many of the places which provide these services have been deemed as non-essential. During the lockdown, more than 15 transgender people committed suicide due to mental health, poor financial status, and the responsibility towards family and partners, which made them resort to such drastic measures as suicide. In order to claim relief packages distributed by Nepal government, people need to show their proof of citizenship, which create a lack of access as many LGBTQ do not have their legal documents with them as they had fled home. And transgender individuals mostly have citizenship documents that reflect the gender assigned at birth, creating problems for them and barriers to accessing proper services, lack of proper relief packages distribution mechanism, lack of information and fear of discrimination and stigma LGBTQ community members are adding to the way LGBTQ people are experiencing this crisis and impacting their health and well-being. When government announced the lockdown as frontline defender, it was so difficult for us to cope the situation and work for the community who need the support during the lockdown at the same time, it was challenging for Mithini when we don't have any resources for such relief activities. It was not easy for us to generate the resources for the relief packages at the initial day of the lockdown. But the development partners, they understand the situation and ready to support. And finally, we were able to reach LGBTQ people for more than 45 districts to provide relief materials and amount to support the needy LGBT people. And another major concern during the lockdown was the preparedness and safety for the community member, because our government does not have any LGBTQ-friendly quarantines and other facilities. And we start to provide the information and safety precaution to the community member from different media platforms, social medias, and different radios programs. Since we face so many obstacles to provide the quarantine to the LGBTQ community, but with the intense lobby and advocacy, we were able to provide few quarantines to the LGBTQ persons from different areas of Nepal. And the bitter fact is state always denial to protect and promote the human rights of LGBTQ community. Since Nepal has legalized the sexual and gender minorities, but still government are not positive to support the LGBTQ community in Nepal, because many stakeholders are homophobic, biphobic, and transphobic, as well as our issues and challenges are always been unseen, because still we are not counted as a human. In this situation, we need allies who support the movement and LGBTQ community. Who raise our voice in such situation, and we need data and evidence which help us on the litigation process. After the litigation process, and after the process, finally Supreme Court of Nepal order to the Prime Minister and Minister Office to remove the clauses to show the legal documents while receiving the relief packages. This order is not only for LBT, this is also for the person who don't have any legal documents. And lastly, I would like to focus on two recommendations to the state, and the state must put in place adequate policies and programs to reduce the inequality in social, economic, and political sectors to address the current issues and need of LGBTQ person in Nepal. And another recommendation is the state should implement the laws and policies to eliminate all forms of gender-based violence and discrimination against lesbian, bisexual, transgender, and queer persons in Nepal. And lastly, we exist and our existence should be recognized. Thank you.
Thank you so very much, Sarita, for those powerful remarks that you've shared with us, and also just highlighting why it's important to have inclusive laws and policies, not just in relation to COVID-19, but also in relation to the normative standards that relate to the question of that we are discussing here today. So thank you very much, Sarita, for that. Over to you, Louise. We are at the halfway point now, and we're going to do a poll before we move on to the next of our interventions. And then after that, we'll move on to a more interactive session where we will be hearing from you, our participants. So over to you, Louise, for the poll.
Thanks very much, Kavinya. If everybody goes to the chat function, there is a link that they can click on to Mentimeter, and the passcode you need to use is 8224907. If everyone does that, we're just going to ask you 2 questions, and we want to hear the results. We basically want to hear what you're thinking about how the presentation is going so far. And as I share my screen, you will actually be able to see the results as they come in. So to the first question, just, click the first thing on your mind. Do you think governments have done enough to address violence against women and girls during COVID-19? And I'm only going to give you 30 seconds before we move on to the next question. Okay, well, you can keep voting on that one, but I'm moving on to the second one here, which is, if yes, what has worked? And if not, what should they do? And it's great. We've already got some really great remarks coming in. These include prioritizing the needs of those most marginalized from power and government decision-making. They need to carry out an assessment of priority areas, holistic understanding of VAWG, for example, prevalence of domestic violence, risks of staying at home. Put more money into women's organizations, charities, and shelters. Oh, I really like that one. Okay, then. I'm afraid I have to stop here so we can get on with hearing all of our other wonderful speakers. But you can continue to enter to the quiz, and I will share the link at the end of our video today for everybody to be able to see all of the answers. Kavinya, back over to you.
Thank you very much, Louise, and our attendees. That was brilliant. Thank you for sharing your thoughts. We've noted that, and as Louise said, we will be sharing the link so that you can see, I guess, the transcription of everything else that everyone shared, but thanks for that. So without any further ado, I will now move on to the next panelist, who is Sally Nuve from the Women's Coalition of Zimbabwe. Sally, please introduce yourself to the attendees before I ask you the questions. Thank you. Over to you, Sally.
Thank you. Greetings, everyone. My name is Sally Nuve, and I'm a feminist development practitioner serving for Women's Coalition of Zimbabwe, a national network of women's rights organizations and activists. Thank you.
Thank you very much for that, Sally, and for that introduction. Now to the questions that I have for you. So the Women's Coalition of Zimbabwe mobilized its membership during the COVID-19 times to advocate and influence on violence against women and girls. Could you please tell us a little bit about those interventions? And also, I know you're really keen on the question of self-care and wellness when it comes to women's rights organizations and activists that are responding to the question that we're discussing here today. If you could also share some reflections around that, that would be great. So over to you, Sally.
Thank you, Kavinya. So with Women's Coalition of Zimbabwe, when we were hit by the COVID-19 pandemic, the starting point was to organize where we would all come together and reflect, building on our experiences of how we have done collective organizing, mobilization, and sustaining each other's energies to hold space for communities we service, for women we work with, for the institutions, our teams, and women who are in various leadership positions who depend on a strong women's movement support that is both technical and that is also moral and solidarity. So our starting point was we had to come together as membership to say, there's an epidemic happening. Let's come together. Let's collectively reflect on what exactly is going on and what are the implications of what is going on to the rights of women, to the rights of girls, to the gender dynamics of our context as we have witnessed it during election times, during humanitarian context situations, during the HIV epidemic that we once responded to. So building on from that, we had to establish a working group which pulled all our membership in its various expertise together to co-create a working group. We then further on went to then say, what exactly do we want to respond on? And how are we going to do that? And who do we need to do what role? So we had to map realistically on where we were standing at in terms of expertise, in terms of resources, in terms of our strategic deployment in all parts of the country. So we had to do a rapid internal mapping to look into, as a movement, where were we strong at and what was our current circumstances and what is it that we could possibly do in order to organize ourselves and mobilize communities and women in their diversity. We then realized that our membership is also diverse. So we had to organize ourselves in committees, one that would deal with frontline responders. Those are the ones that were directly working with communities and providing services and giving legal advice and support, providing shelters for violations of rights that would have happened, and also those that would use their facilities as access to health point centers. We then established another one that was dealing with information and communication, and this was to do our community outreach, our awareness, raising awareness of the epidemic, the regulations that were put in place, and ensuring that we would continue emphasizing and accelerating the issue of women's rights education in the context of trying to prevent sexual exploitation and abuse during the epidemic times. The other committee was now on resource mobilization because we were requiring, from experience, all our collective organizing work required us to pull our resources together, to negotiate with our current funding partners that we had at the moment, to pull resources that we had together. So we had to put in a resource mobilization and donations committee to work on that. Then we had an advocacy committee, which then would deal with our monitoring of women's rights, gender-based violence, violence against women, trends analysis. And today we are going to be publishing our 352 copies. So every day we had a deployed infrastructure of women's rights monitors at community level, who through our technology platform would gather data, we verify, we consolidate, we do an analysis and come up with a situation analysis report that we would flag emerging advocacy issues. So we've also done strategic deployment of women, including our members, in the national COVID-19 response structures at community level, at district level, provincial and national level. So that strategic deployment would ensure that we were sitting at the table and providing technical support for those that are participating in the national processes. Then we had to convene also duty-bearer online platforms to facilitate for women to interface and engage them and hold them to account. And we've established also an advocacy tracker where we would go to duty bearers and actually tell them that, you know, we are sending you this communication and you haven't responded. We also sought audience and did strategic deployment for our members to the Office of the President in Cabinet to express the advocacy issues and our queries and all the things that were not working for us. So really how we managed to do it, we had to organize, we had to do collective advocacy, we had to track advocacy and keep pushing, but we also had to sustain the momentum because we are also not immune to COVID-19. So the issue of self-care that you spoke about, the coming in of COVID-19 disrupted our way of how we had learned on how self-care and collective care should be. We were looking outside our homes, outside our office places for self-care services. But with the coming in of COVID-19, it meant we had to look in and strategize from within and use virtual platforms and tools to safeguard each other and keep each other in check. So some of the things that we managed to do was to begin to confront our ways of working and be flexible in acknowledging that because women we work with, including us, had now an added layer of the issue of care work, they also need to pay attention to their wellness given what was going on. So we started negotiating and reorienting our rules of working into deliverable based so that people could adjust within their working times and be, and be sensitive to other intersectionalities of the roles that they play. The other issue was we then started using the online platform that we organized because we have different WhatsApp groups where we would monitor even the members' participation. And when we would see members sinking in depression, some would then have to do direct engagement with them. And we had to use in some tools like Canva and Pinterest to look for flowers, design e-cards that would lift them up. And then we had, when the heat really got tough, we then had to combine our mobilization with wellness, where we actually had to train some of our members on psychosocial support, counseling skills, so that they could also be a resource within the movement because we had not trained for the COVID-19 context. And then we had to have a specific series of sessions with psychologists who would come and strengthen our members for our mental wellness. But moving forward, most of the things that had to deal with our self-care and collective care were centered on public service provision, the access to water, access to clean, affordable energy, access to decent accommodation. So there are things that then emerge to say, as facets of self-care, is our infrastructure ready for the self-care that works for us at individual level and at collective level? When we look at the things that make women well, and navigate the complexities of their roles in the context that they live in. The issue of advocacy around public services emerged. The access to health facilities, the checkpoints, our nature of sexual and reproductive health complications is not written on our forehead. So issues around sexually transmitted infections, the checkpoints, people wanting prescriptions, it's something that we had to collectively push back to the enforcers of the lockdown because they always thought anything about access to health, for you to get a pass of the checkpoint, you had to show evidence. Yet we know our reproductive structure and organs are internal and are not visible. And it is my right also to have the dignity of not being exposed to explaining at every checkpoint that I go in. Then the issue of collective wellness also came into the issue of resourcing the work of women's rights. So the issue of the funding status of women's rights continued to be an area of concern, and it has deepened in the COVID-19 context. So we had to do series of donor roundtables, negotiating, lobbying, engaging, and also sharing best practices of partners such as Womankind, of resilient fund support to our current funding partners, to start showing them that if you are to meaningfully engage and invest in women's rights work, there is also an issue of institutional wellness, which also comes in with mechanisms such as resilient support, resilient funding that is flexible. So we also had to have focal points for the teams that we work in, where there are wellness focal persons, and would do series of scheduled wellness situations. So those are some of the things that we managed to navigate and work on as a collective. It hasn't been easy. It continued to be challenging, but we have then we had consensus to say, how do we build stronger together and hold each other's hands, an institution at a time, a person at a time, so that we are strong for the community and the constituents that we service. Because when all is said and done in any epidemic, the women's movement is there to clean up, pick up, and build the future. Thank you.
Thank you so much, Sally, for those powerful interventions. In fact, I feel like it would be an injustice to even try to pick pick a highlight from the conversation that you've just given us, but so much to think about in terms of building stronger together. Thank you very much for that, Sally. So I'm going to switch gears a little bit, and I think also just ending on, one of the points that you highlighted towards the end there, and segue into a conversation around feminist funding in a time of COVID-19 in relation to the question that we're discussing, which is violence against women and girls. And so I'd like our next panelist to introduce herself. Carol, you're up next. Please introduce yourself, and then I will proceed with the questions that I have for you. Over to you, Carol.
All right. Thank you so much, Kavinya, for giving me an opportunity to add my voice or our voice to this important conversation. I am Carol Werunga. I am the Program Coordinator for Solidarity and Support at Urgent Action Fund Africa, which is a feminist Pan-African rapid response funder who is committed to transforming power relations through resourcing African feminists and women human rights defenders in all their diversity and their formation as an act of solidarity. So thank you.
Thank you so much, Carol, for being here, and also, for that introduction of yourself and the work that UAF Africa does. So it is my understanding that close to 50% of the grants that were provided by UAF Africa during COVID-19 were actually linked to addressing the question of violence against women and girls. What are some of the core lessons that you learned in funding WROG-related interventions during COVID-19? And also, if you can maybe, as a feminist funder, make some recommendations, to donor partners and governments, and of course, our colleagues in civil society around the provision of resources for WROG-related interventions. So Carol, over to you.
Thank you so much. So some of the core lessons that, of course, we learned supporting violence against women and girls during COVID-19 is, first of all, this is not new to us. We have supported similar initiatives, during like the Ebola crisis in West Africa. And, some of these things are not new because we know during, such kind of pandemic, issues around violence against women and girls is heightened. So, but some of the lessons that we got out of support, and we continue as we speak, we are continuing to support that, is that both prevention and response initiative are important. And as we know, prevention initiative focuses on transforming the power dynamics and gender inequalities that lead to, violence against women and girls in the first place. And we know that response initiatives or efforts, on the other hand, focuses on securing services, resources, and support for survivors. So during a pandemic such as this one that we are all grappling with right now, we already know that violence against women is heightened, and it is therefore important to support survivors, for example, by providing psychosocial, physical, and also economic support, and collective care and self-care, healing, justice, and well-being is critical. Because as we have heard from my other colleagues speaking about this issue, there's issue of burnout. And it is very important. And for us as a feminist fund, this is it is also political. So for us, when we support collective care and self-care and healing, justice and well-being during pandemic and other, crises, this is political. And we as a funder, we supported and continue to support women rights organization and gender non-conforming groups to set up and sustain safe houses and shelters. We also and continue to provide sanitizers, masks. We have also even provided medical supplies to women with disabilities. We have supported groups to set up toll-free emergency numbers. We have supported collectives, supported groups to set up or support the defenders or activists and movements they work with the collective and self-care and healing justice initiatives. And whereas in a pandemic, the response efforts that focuses on supporting survivors with resources and services may seem urgent and important, but the prevention efforts also that I spoke about, that focuses on transforming the power dynamics and gender inequalities that actually lead to violence against women and girls in the first place, are equally important, hence should be supported. So it is good that you try as much as possible to support the two, so that at the end of the day, we have that transformative and systemic change that you want to see. So for example, as a funder, we supported as one of the preventive, efforts, we supported groups to conduct media and digital campaigns to advocate for, non-violent relationships that, my colleagues have spoken about, And also we have supported groups to lobby, petition governments, including the judiciary and the police, to integrate GBV response in their COVID-19 mitigation efforts. We have also supported groups to create awareness around violence against women, including sharing information in disability-friendly format. We have also supported, and we continue to support groups to document the impacts or the gendered impact, and GBV or violence against women has been a key focus on some of the impacts that we are seeing or we are receiving as part of the documentation that some of our partners are doing. So another lesson is that intersectionality in supporting violence against women and girls is critical. Epidemics and pandemics, as we have all heard, affect women and men differently, while aggravating existing inequalities for women and girls and further discrimination of other marginalized groups, such as women with disabilities and gender non-conforming and non-binary person. Therefore, there's need to be intentional in supporting defenders with disabilities, gender non-conforming defenders, and other structural excluded groups. As a funder, we provided both prevention and response support to these groups, and we have developed call for proposal targeting the mentioned groups because we know the intersectionalities that actually are heightened during pandemics. So the last question about what are some of the, recommendation to, other funders or donors and government with regards to supporting or providing resources for women, violence against women and girls in their diversity going forward is that, first of all, there's need to increase funding to women rights organizations and women funds who are currently and continue to be frontline, defenders responding to the silent pandemic of violence against women and girls. There's need to increase budgets for effective monitoring, knowledge generation and dissemination of evidence-based lessons from feminist activists doing this work. There's need for investment in greater advocacy efforts to push governments and states with no specific laws on violence against women, and so that they can draft and adopt them. For those who have them, there's need for funding, and sustainability of monitoring activities or intervention to ensure that enacted laws on violence against women are fully implemented. There's also need for more collaboration among donor partners working or funding work on around this issue for better coordination. And also there's need for deliberate efforts for intersectionality approach in resourcing women in their diversity work on violence against women and girls. This approach helps us to serve these individuals and defenders and activists and groups at a heightened risk of violence, and the groups that are at a heightened risk of violence even better. Because as I have mentioned, we know that these issues are heightened, so there's need for that intersectionality approach when we are supporting this kind of work. There's, of course, the need of political will. And we know very well violence against women and girls is deeply rooted. It's a deeply rooted issue that is yet to be fully addressed. And because of the rooted gender inequalities and oppressive systems, and as we have mentioned earlier, patriarchy is one of those oppressive systems. So most of the time we have seen that there's no political will from government to address this issue. That's why when you see there is limited support or limited resources from government allocated to issues or efforts that seek to address this important issue. And I will finish by saying that as a feminist fund, which is a Pan-African fund, we continue to stand with you in solidarity. And we are currently, we have a special call for proposal around feminist COVID-19 response, targeting LGBTI groups, targeting women with disability, and targeting, feminists and activists in general. So I'll just put the information on the chat box. So when you get time, please, and if you are a feminist organization, a feminist movement, a women's rights organization based in Africa, please get time to look at the our website or the information that I'll put on the chat box for you to see how we can work together. So thank you so much for your time and your listening here. Back to you, Kavinya. Thank you so much.
Thank you so much, Carol, for that intervention, and thank you for the recommendations that you have made, and above all, for reminding us that really at the heart of addressing this issue, that we really have to work on transforming the structures and the systems that are patriarchal, that continue to perpetuate violence against women and girls in their diversities. Thank you so much, Carol, for those remarks that you made. So I'll now hand over to my colleague Dinah, who is our last panelist for the day. Dinah, please introduce yourself, and then I will proceed to ask you the questions before we wrap up. And we're coming very close to the end of our conversation today. So over to you, Dinah.
Thank you very much, Kavinya, and thank you very much to all the speakers who have spoken before me. My name is Dinah Musindarwezo. I'm Director of Policy and Communications at Womankind Worldwide. I call myself an African feminist, and I'm based here in Nairobi, Kenya.
Thank you so much, Dinah, for that. So on to my question. So in 2019 and 2020, Womankind collaborated with other feminist organizations to produce a reflective report on the Beijing +25 process. It also engaged in other initiatives to provide flexible funding for COVID-19 support. So based on these interventions and in view of Womankind's engagement as a feminist organization in providing leadership during COVID-19 to address violence against women and girls, what are 3 key lessons and recommendations that you'd really like to highlight in the context of CSW, and also because, of course, the generation equality conversation is now in full gear. So over to you, Dinah.
Yeah, okay. Thank you, Kavinya, for that question. So before I go into the recommendation, I wanted to highlight that the report that Kavinya has referenced is a report that was led by Womankind Worldwide, but in close collaboration with other women's rights organizations, including AWID, Agent Action Fund, Civicus, and our partners, especially drawing on their numerous parallel reports that they had developed at the country level in the context of Beijing Plus 25, but also really got inputs from those women's rights organizations that had been mobilizing and organizing at the country level to highlight progress made on Beijing Declaration Platform for Action. And so why did we want to do this report? We wanted to do this report mainly to draw attention to a feminist analysis and perspective on where we think we are as far as the 25 years of Beijing Declaration Platform for Action is concerned. And we also wanted to show the existing gaps and make concrete recommendations, especially focusing on the structural inequalities that women and girls are facing in the world at that time. I have to say that when we started working on this report, it was before COVID-19, and even then the progress towards achieving the Beijing Declaration and Platform for Action was extremely low and slow. And so in the middle of developing the report, COVID-19 happened. And what we're experiencing even doubled or tripled. And so that also then informed how we framed and finalized the report. And I really do encourage you to look at that report on our website. And I'm sure our partners also have it on their websites, the partners I've mentioned. And so when COVID-19 happened, as Womankind, as an international women's rights organization working with national level women's rights organizations, we were happy that we were able to provide flexible funding to all our partners, about 47 partners in different focus countries, where we work in 5 countries, both in Sub-Saharan Africa and Southern Asia. And we did that mainly because, one, because we were lucky that we had flexible funding, mainly due to generous individual women that see it important to avail resources that are flexible to a women's rights organization like Womankind. But also because of the demand that we're getting from our partners, mainly because of increased demand for their services that were also happening in their countries and their context, coming from the constituencies they serve, And these demands were ranging from, ranging from the existing services that they were already offering, such as responding to violence against women, which we know that existed before COVID-19. In fact, it was like a pandemic already. And providing things like shelter, online counseling, legal advice, etc. But also new demands emerged that, probably the women's organization weren't at the core of providing these services, including PPEs for protecting themselves from COVID-19, but also foodstuff, medicine, etc. As you have heard from the partners and women's organizations at the front line, sharing how they had to respond and provide these services. And so I think that really shows the role that women's organizations do play, not just during what we call normal time in quotes, but also during the crisis. Because oftentimes when crises happen, we tend to think that it is the big organization, humanitarian, the one that are named humanitarian organizations that do actually intervene. Yes, those do intervene, but also women's rights organizations do play a huge, crucial, and vital role to actually provide these services that are extremely needed in times of crisis. And not extremely needed, but also urgently needed. And so my recommendation then, if I start going into recommendations, but also lesson one, the first lesson we learned is the importance of flexible funding. But also that's something that we knew before the COVID-19 hit, the importance of flexible funding to go to women's rights organizations. And we knew that women's rights organizations do play a crucial role during crisis and during normal times. And so, really, the recommendation is around ensuring that we do provide, flexible, core, long-term, accessible funding by eliminating all barriers to accessing resources from domestic and international sources. We heard from Sally, for example, when she said, when COVID hit, we had to mobilize to organize our communities, but we also had to start mobilizing resources, and that involves writing proposals, making phone calls, writing emails, organizing donor roundtables. This is in terms of, like, if you remember when COVID-19 started, for many countries, you are not able to move at all, but yet you feel like you cannot ignore your communities. All these demands are looking at you, and you have to, on top of that, be actually writing proposals and organizing donor roundtables. And so in a way, it takes away the agility and the ability of women's organizations to actually act very quickly and be able to respond to demands. And so if they had those resources way before the crisis, they would have been able to tap into them, and they would have been able to respond even more effectively than we have had today. And the second one is around COVID-19 recovery. We know that before even COVID-19 hit, it wasn't that we had a world or a society that supported gender inequalities, or that the existing inequalities weren't just as deep as they are. Of course, COVID-19 deepened those inequalities, but we really do urge policymakers and civil society to take this COVID-19 crisis as a moment to advance a more just and gender equal world. We must ensure that we do not replicate the current models of development that are deeply violent, exploitative, and unsustainable. We all deserve a recovery, not just from COVID-19, but from years and years of injustice, abuse, and exploitation. So let's start by, ensuring that even the vaccination that is now in place is equitably and that can be accessed by all people everywhere they live, and should not be determined by where one is based, the color of their skin, their ability, their sexual orientation or gender identity, or indeed how much money they have in their pockets. And the final one for me is really calling all policymakers and our governments in particular to accelerate efforts to eliminate all forms of violence against women and girls, as we have had also those recommendations from other speakers, that ensure that they tackle the systems of oppression, including patriarchy, capitalism, and racism, and other systems of oppression that fuel gender power imbalances and deepen the gender inequalities that cause, perpetuate, and condemn violence against women and girls. So our government need to mobilize maximum available resources to fulfill their role as the primary duty bearers for the respect, protection, and realization of human rights of all women, girls, and gender non-conforming people, including by committing to fully implementing the Convention on Elimination of All Forms of Discrimination Against Women, that's CEDAW, and its optional protocol, as well as international and regional human rights treaties to remove all the remaining reservations, but also to ensure that they do implement the commitment that do exist within the Beijing Declaration Platform for Action. We are at the time of the process also of Generation Equality Forum and action coalitions have been formed. And really my call today is that we need to commit to actions, to tangible actions, including availing resources that are needed to implement Beijing Declaration and Platform for Action. We cannot commit to words again because we have beautiful words already existing in Beijing Declaration and Platform for Action. So we are not looking for that, but we are looking at ways that leaders are going to commit resources to ensure that indeed those beautiful words and those commitments can be implemented and transform the lives of women and girls everywhere, taking an intersectional approach. I'll pause here.
All right. Thank you so much, Dinah, for that thoughtful intervention, and really for reminding us that in this time, based on the conversations that we're having, we really need to move from rhetoric to action to ensure that we have a more just and equal world, so that we do not replicate the inequalities and the violence that we have and continue to experience. So we are almost at the very end of the time that we have allocated for this call. We'll give you an opportunity as our attendees to write any comments and questions that you might have in the chat function right now. And then I will also ask my colleague Louise to queue up the post-its that we had for this session. But also, if there are any questions or any comments that are arising, I'll also give our panelists one last opportunity to perhaps respond to them, if there are any. Again, as I said, we are almost out of time, but we have a few minutes. Any questions? Okay. So there's one question that's coming up around how we are all applying social media to share our stories. Okay. All right. So in the order that we started, perhaps I'll just give each of the panelists an opportunity to give one parting shot, very short, because we are out of time, and perhaps respond to the question that we have. And then also do us a favor and share your takeaways from today in the post-its that have been provided. The link is in the chat function. So I'll start with you, Mishi, your parting shots, and perhaps also responding to the question that Nicole has asked.
Thank you. Can you hear me?
Yes, we can hear you. Please proceed. Your parting shot very quickly.
Okay. I think it's important for everyone to know, understand, and believe that violence is not normal, and violence is a reflection of power imbalance, and violence is not legal. Violence, as Dinah said, violence has been legalized. So it's important, all of us now, to start walking the talk and invest. Our call has been investing resources, but also our call has been all of us to be an active actors, because at the end of the day, it takes us to say no to violence. It takes us to report. It takes us to nurture community which has unlearned about violence. It's important to change the tradition and norms and not to justify violence. So that will be my calling shots for today. Thank you for having me.
Fantastic, Mishi. So Jane, over to you very briefly. Your parting shot. Jane, are you there? If Jane isn't there, can we move on to Sarita? Sarita, very quickly, your parting shot.
I was muted.
Okay, Jane, so very quickly, your parting shots, and then we'll move on to Sarita.
Thank you, Kavinya, for the good work you have done to moderators. And as we come to the end, my parting shot would be, as we are in the third wave of COVID, and I think this is affecting everybody in the world, COVID-19. And so still we have not seen much being done in terms of inclusiveness, fighting of gender-based violence against women and with disabilities. So we want to see more being put in place for women with disability to be able to access health services without being isolated, with inclusiveness. So for me, is that to urge everybody here as we go home, let us also think of women with the disabilities who are not homogeneous, but only that they have special needs that needs to be addressed.
Thank you so much, Jane, for that. Sarita? Your parting shot?
Yeah, thank you so much. And yes, finally, I would like to thank you for this opportunity. And we urge the state to effectively include LGBTQ people in all COVID-related policies and measures, and to put in place specific and target plans and programs for those most marginalized in the LGBTQ community. And finally, if we are talking about the gender equality, then we need to respect and we need to promote the diversity as well. Thank you.
Thank you so much, Sarita. Could I ask Carol to go next?
All right.
Your parting shot.
All right. Thank you so much. And for me, it's just to encourage my fellow feminist activists to continue with this important work, and also just to remember that we can't pour from an empty cup. So we need to take time to take care of ourselves so that we can continue with this fight. So thank you so much.
Thank you very much, Carol. Sally, over to you for your parting shot before we end with Dinah. Sally? Sally, we can't hear you. Okay, Dinah, perhaps we can come to you, and maybe if Sally is able to join us before we finish, then we will come to her. Your parting shot, Dinah.
Thank you, Kavinya. So for me is one, also to build on what Carol has said from Agenda Action Fund Africa in terms of caring for ourselves as activists, as human rights defenders, but also collective care, caring for ourselves, but also caring for each other across different movements within the broader women's rights kind of feminist movement, because within that, we also have women with disabilities movements, LGBTQI. And so how do we across those movements care and support and stand in solidarity with each other? Because that's exactly what we need today and any other time. And so collective care is extremely important, but also if there are donors on the call, is also to fund with care. And what does that, and ask yourself what that looks like. And finally, to thank each one of you on the call. Thank you so much for joining this call. I'm really happy that you found it interesting and hoping that we will continue these conversations.
Thank you so much for that, Dinah. And finally, Louise, perhaps you can queue up the post-it so that we can see the feedback that we have received from each of you in terms of your parting shots. And just to echo, thank you so much for taking the time.
I think Sally is now available. I think Sally is available. I can see her.
Oh, sorry about that. Sorry about that, Sally. Please proceed with your parting shots before my colleague Louise then posts everyone's feedback and their parting shots as well. Thank you.
So thank you to all the partners and all that joined us. For me, really, COVID-19 contexts have put all of us to test at individual level, within our loved ones, at community and institutional level. So for me, really looking into our life as we proceed to strategize around it, it's around how do we become practical on self-care and well-being? And how do we put in mechanisms and safeguarding practical tools and investments so that we really don't run ourselves down? So for sustainability of movements, there is need for deliberate investments on practical tools, mechanisms, the tools of organizing that work, and this digital divide that continue to broaden. There is need for us to ensure that the telecommunication companies that are ripping women apart, the class division that continue to rise because of digital divide, that it's disrupted and it is stopped now. So we all have collective responsibility for sustaining the future we want, but investing in women's movements is the starting point, because we have always done that pre, during, and in the current circumstances. So I continue to brave on, to get up with sisters that are here, embracing technology, but also paying attention to the emerging threat of online gender-based violence. So safeguarding continue to be something that is calling us to duty, mental health and well-being for women, human rights defenders, then sustainable investment in women's rights organizations and movements. Thank you.
All right, so thank you so much for that. Louise, do you have the post-its queued up for us?
Hi, yes, I do, Kavinya. Unfortunately, it seems that all of our guests have been so mesmerized by our panelists in their parting words that nobody has added anything yet. So I appeal to you all now, please do pop into those post-its and write down some of your parting words, your actions, your recommendations and takeaways, as we do really want to hear them. Back over to you, Kavinya.
All right, thank you so much for that, Louise. There's also been comments that have been coming through the chat function, and so we're very grateful for that. So we'll end here. Thank you again for your time and your attention. We hope you've taken away something from this discussion, and we will continue the work on and offline, and we will be in touch with all the resources that have been shared in relation to today's conversation. So stay safe and stay well, and have a productive CSW and generation equality. Bye for now.